my question for you, now, on the same question I just threw to them, are you guys or your firm, or has there been any chatter in the legal community about um the civil, because I that you protect, like, the people's rights. So if I had a claim against a company or against are you building departments, or are you starting to get phone calls from people saying, hey, I feel like my rights were distorted, can you represent me? Are you getting any of that as a result of COVID?
So yeah, I mean, there have been a lot of phone calls that we've received where people are asking about what options they have when they've lost loved ones and the like. But as in many states, our governor signed a decree that basically immunized those who are rendering care to COVID patients. And it's understandable to a degree why that is, but the backdrop of that is, or I shouldn't say the backdrop, but the backlash of that is that people are left without recourse in a lot of ways. So you'll have instances, or at least I've heard stories about people having their loved ones dropped off by ambulance personnel, knowing that they've got COVID symptoms and that they're in dire straits, but won't take them to the hospital. This is earlier on. I haven't heard of those sorts of stories recently, but I've heard those sorts of stories, and I know them to probably be the case. But because there was such an onslaught, and because there was so little known, and because there was so little protocol in place, people were being subjected to the harsh realities of life.
I wonder what the Amish are doing, because those are some foundational Americans, as are most of us. I just wonder what the Amish are doing. But because they're separate. It's almost like reservations and stuff. They have their own little government. So that was just kind of a thought. But true or false, doctors? True or false? African Americans or blacks are more genetically prone to contract. That's one part of the question, and or spread the coronavirus. True or false?
Not genetically prone to catch the disease, but we have certain health issues within our population that make us more susceptible. We have housing arrangements which make us more susceptible. We're living on top of one another. We're living in really tough situations a lot of times, and so we in these environments, along with our diets and the stress, like Jarek was saying, the stress of just surviving, as opposed to, most of us can't go and take a walk in the park and not be shot at or something like that, and so that real
Mm-hmm.
stress, it puts a strain on your immune system as well. So that's really initially why I think and our lack of access to quality healthcare and quality preventative and maintenance as far as healthcare is concerned. Those were the conditions which led to us being really stricken, I think, out of proportion to the other parts of the population.
Yeah,
Dr.
multifactorial.
Conrad, I mean,
Oh,
Dr.
sorry.
Honorary, go ahead.
Yeah,
No, go ahead, Honorary.
Like the
I'm
Dr.
sorry.
Gay said, no, multifactorial reasons. Like you said, that we are already having disparities in healthcare. Like I said, access, education, preventive measures, as well as multi-generational households. Like he said, we're living, and if you're in urban centers, you're living on top of people, and you don't have access to get out, get away, get out. Can't go to the park. Like you said, they may not be a park. They may
Hmm.
not access
Or,
to,
or or you
or
can't go in there because
can't
they're gonna take everything.
they're gonna take
Take
everything you
everything
got
from
from you. Also,
you. Give me
workers too.
everything.
Our workers. I mean, we have people who are employed in the service industry on the front lines, and have to go out and work and do those jobs with
Facts.
higher
Facts.
for transportation. They have to take public
Facts.
transportation, or
Facts.
and
Facts.
so all that is a factor is leaves African Americans and people of color more open to get the virus, more exposure. I'm saying, so they're going to be
Facts.
exposed to the virus on a higher level too,
Dr.
along
Conrad.
with all of the health issues and mental health issues too. You got to think about that too. There's a lot of multifactorial things going on there.
Okay, facts.
Yeah,
Dr. Conrad.
Mills, so we just talked about all these issues, that we have. And I mentioned in the last question about us being, disproportionately, relegated to the bottom in all these aspects of quality of life. And we know that systemic and structural and institutional and individual racism, all contribute to that. And we need to be working on that. So we have to have people who are working to put pressure on the system. But, I also bring in the other part of the conversation. Let's not make ourselves easy targets for this stuff. Some of it is in our control, right? Some of it, let's just not just make it easy. Here, just take me,
Right.
Let's control what we can. So we got to do both at the same time. And that's just hard. I mean, it's difficult. It's a challenge, but we got to figure out a way to do it more than just a handful of us. We always talk about the handful of people who've become very successful and you can do anything about, all this anecdotal stuff, but we got to create systems and structures to bring that to scale so that we can have more of us be able to have these conversations as opposed to being on the other side while we work to dismantle those systems that have been in place for hundreds of years.
Bro, it's 2021 and I almost shudder to say amen. You know what I mean? I'm serious. That's the world I live in, where I feel ashamed to say amen. But amen to that. And speaking of amen, places of worship